Hi, I'm Al Walsh, and I'm the pharmacist at Fertility Pharmacy Services, located at the Art Clinic in Halifax, Nova Scotia. Today I'd like to talk to you about the preparation and use of the Gonal pen. So let's get started. Before you begin, it's important to wash your hands well and have a clean work area. Now, the Gonal pen is a pre-filled cartridge with your medication already present within the pen itself. It's actually very easy to use. It has a little window on the side where you dial up your dose using this, as I'll demonstrate in a moment. And as you gradually deliver the medication, the dose will dial back down to 0. So the pen itself comes with needle tips, and these have to be actually screwed on the end of the pen, and alcohol swabs. So I'm going to open an alcohol swab and remove one. This one's going to be used for swiping off the threads and end of the pen where the needle attaches. So I'm going to use the alcohol swab to gently remove anything that's on the outside edge. And I'm going to open my needle. So this needle itself has to be pushed on and screwed on. So it's important when you actually putting the needle on the end of the pen to put it on straight. Push it on straight, not on an angle. So gently we'll push it on, and then we will screw the tip on until that's snug and tight. If I remove the cap, there's a small green cover which covers the needle itself, and that can be removed. Hold on to the cap because the cap will be used to remove the needle after you're finished your injection. So with the Gonal, there is a small window, and through that window you dial up your dose in units. So it measures in units. If you dial up the dose by turning the dial clockwise, you can dial up to your dose, and through the window you will actually see a numerical value. Once the dose is dialed up, you're ready, your pen is ready, and you're ready to inject. Now if you go beyond your required dose, you can actually dial it back to the dose that you're supposed to use. So I would open up the alcohol swab to use to prepare the skin, and this is a subcutaneous injection. And I'm just going to demonstrate how the device works, but when you do your actual injection, we will have one of our nurses take you into a room to demonstrate the proper technique for subcutaneous injection. So I would use my alcohol swab to swab the area of the skin. It's important to let that dry before actually administering the injection. And then as I pick the pen up, I'm going to push the needle straight into the skin all the way, and I'm going to grasp the barrel of the pen and slowly push the end of the pen until it bottoms out. As I do that, the dose that's been dialed up in the window of the pen will gradually go back to 0. I would wait 10 seconds before I'd pull that, remove the needle from the skin. And I would have a Kleenex on hand or tissue to massage that area. Sometimes there may be a drop of blood or a little bit of the medication that drips out. That's why we have a tissue on hand. To remove the tip off the end of the pen, you use your cap once again, and you're going to snap that over the top and unscrew that counterclockwise. Your tips can be disposed of in your medical waste bag along with your other medical waste. The pen should be recapped and stored for your next dose.